Some of that help is already here with dozens of New York City nurses in Utah for at least the next 2 weeks, and more reinforcements are on the way. Hospitals in the Intermountain system and all across the state, really, they've already been doing everything they can to deal with Utah's rising COVID case count, like reallocating and adding beds at different hospitals, while asking nurses and emergency room staff to work overtime and extra shifts. But it simply hasn't been enough, especially now, to deal with our ever-increasing number of COVID-19 cases. So as part of a partnership already worked out with New York Presbyterian Hospital, that's where dozens of Utah nurses went to help with their surge back in March. 200 nurses from New York City, they are now in and heading to Utah to lend a hand. It's part of the agreement everyone involved hoped they would never have to implement, but are now glad that this plan was in place.
Now it's our turn to come and help return the favor here. The NYP nurses on this trip each volunteered to come for 2 weeks, leaving their families and friends home in New York City.
A battle is easier won together, and it is the circle of trust and support that has kept us going.
Nurses and doctors from both hospitals, and really from all around the country, say this is incredibly difficult and oftentimes heartbreaking work, physically and emotionally exhausting. And they're relieved that they've had all of this worked out ahead of time. Intermountain Healthcare, which is Utah's largest hospital system, they're also in the process of currently hiring 200 traveling nurses, trying to do everything they can to deal with this surge. And the message again from everyone involved, doctors, nurses, anyone related to a hospital, is for everyone out there to please wear your mask, practice safe social distancing, wash and sanitize your hands frequently. If not for you, for someone you love, someone who may wind up in the emergency room with a case of COVID-19. In Murray, Scott McCain, Fox 13 News, Utah.